Okay, First Lady.
Thank you, Shannon. Hello, everyone, and welcome to another installment of our Ask an Expert series. Before we launch into our conversation, I just want to say, surely on behalf of us all, how very devastated I am by the senseless murders we witnessed serially across our country, and especially yesterday in Texas. My heart breaks for everyone impacted by this latest tragedy. And I am really sick of our inaction, the action of leaders who are in the pocket of the gun lobby. We need to stand together and do everything we can to bring about the common sense gun safety measures desired by the majority of our country. But for now, bless those poor children, the teachers, and all who have innocently perished across the country due to this scourge of gun violence. On another topic, and before I introduce our panelists and start our discussion, I want to give an important update regarding the shortage of baby formula. On Tuesday, May 17th, the governor issued an executive order declaring a state of emergency in order to activate state price gouging laws. Importantly, this executive order also coordinates relief efforts and enables state agencies to take any emergency measures necessary to protect families from issues arising from the shortage. Further, we have worked with the Department of Health to issue guidance to families to help them access nutritional support and resources, including information on WIC and the local maternal health consortia. And we launched a website, nj.gov/baby formula, to house information and updates regarding the shortage. Again, that website is nj.gov/baby formula, and we will put a link to it in the description. Ensuring that every parent is able to keep their baby fed and healthy is our urgent priority. So please share this information across your social media channels. Now, I will shift to today's episode focusing on HealthySteps, a pediatric primary care program aimed at delivering needed services and support to families. It is my honor to introduce our guest experts. With us today, we have Dr. Ghazalah Malik, a board-certified pediatric hospitalist from Hackensack Meridian Health, who is currently working at K. Hovnanian Children's Hospital. Dr. Malik has been at K. Hovnanian for the past 6 years. She is also the Associate Chair of Health Equity and Advocacy at Jersey Shore University Medical Center in Neptune. Dr. Malik is a physician champion for the HealthySteps program at Jane H. Booker Family Health Center. She is also the clinical assistant professor of pediatrics at Hackensack Meridian School of Medicine at Seton Hall University in South Orange. I'm not sure he got it all done, but welcome, Dr. Malik. Next we have Hope Lajul, a HealthySteps mom who has one amazing son who's 3 years old. We can see him. Welcome, Hope. Also with us is Karma Campbell, another participating HealthySteps mother. Karma is stay-at-home mother of 2 children, the eldest of whom is 2 years old, and the youngest child is just 4 months old. Welcome, Karma. Congratulations on the new addition to your family, and we'll let you introduce that one in a minute. Next, we have Tierney Vagts, a licensed clinical social worker and HealthySteps specialist for both Asbury Park Pediatrics and Neptune Pediatrics in Monmouth County. Ms. Vagts has spent the majority of her career providing advocacy, counseling, case management, and educational services to pregnant and parenting teens and young adults. Ms. Vagts has an abundance of experience in treating issues related to family planning, child development, early relational health, intimate partner dynamics, and trauma-informed care across a variety of settings and populations. So welcome, Ms. Vagts. And our final panelist is Dr. Melissa Wallach, also from Hackensack Meridian Health. A little over 3 years ago, Dr. Wallach joined the faculty at Jersey Shore University Medical Center, where she is the Director of Medical Education for the SGU Medical School Program and Director of Quality Improvement for the Pediatric Primary Care Practices. She also sees patients in offices in Neptune and Asbury Park, where she is the physician champion for the HealthySteps program. Welcome, Dr. Wallach, and thank you all for taking the time to be here today. I want to get right into our Q&A, but of course, if there is anything further you'd like to add about your backgrounds, please feel free to share it with us when you first respond on the panel. And for all viewers who are joining us, please feel free to add your questions to the comments section, and we will do our level best to get to those if we have time. Okay, so our first question is for Tierney. Tierney, what is HealthySteps, and how is the HealthySteps program incorporated into a child's routine pediatric care?
Thank you. So HealthySteps overall is an evidence-based model. It really places a developmental specialist at the heart of the outpatient pediatric setting. So what we do is HealthySteps works with families, specifically with children ages 0 through age 3. We focus on concepts really including, but not limited to, social and emotional wellness, mental health, behavior, physical and motor development, cognition, and environmental challenges as well, or needs that families might have. Almost all families take their children to see a pediatric primary care provider. I believe the statistic is about 90% of families overall. And on average, new parents attend 12 to 13 well-child visits in the first 3 years of a child's life, which is also the most critical time or most crucial time of child development. So by incorporating HealthySteps into the pediatric setting, we're building consistent and strong relationships with these parents. We're focusing on interwoven skills that physicians essentially just don't have necessarily the time for, or the opportunity for, to capture in the well-child visit itself. So what we'll do is we follow what's called a warm handoff. After the patient is seen by our pediatricians, the physician will provide a brief overview on the HealthySteps program, and they kind of hand off, if you will, the opportunity for myself to go in to meet with these families and provide them with the services necessary, and I'll take care essentially of the visit from that point forward.
Excellent. Thank you so much for that background. It's great to see how this kind of program fits easily into a child's routine care. So it's easy for mom and child to get the comprehensive care that they might need. Our next question is for Dr. Malik and Dr. Wallach. I wonder if you could share, why did you decide to bring HealthySteps into your office, and excuse me, has it changed the way you deliver care to your patients?
Yeah, so I'll go. We have been very fortunate that we were exposed to this idea of HealthySteps, which actually has been brought to many other states, and it's new to our state of New Jersey. It was pitched to us as an idea, as a pilot program. And if the program, depending upon how well it goes, then we might be able to convince the state and the Medicaid to fund it for all the locations. So that was our first motivation, that providing this sort of, a comprehensive support to our families. And depending on how that goes, that could be expanded to all the needy families in the state, was a big motivation for us. We already know the track record of HealthySteps from other states, how well it has done, how many lives it has changed. And we know from the patient population that we serve at our institutions that, healthcare doesn't just end in the office visit, right? There's so many other barriers to healthcare, for families, for parents, that just trickles down to the child's life and health. And sometimes as physicians, because of our time and our limitations, we're not able to reach to their homes, for example, or into their personal life and their problems. With all the good intentions, we want to, but we are really stretched thin. To have a specialist who trains in this, who focuses on 0 to 3 at our location is such a big gift to our locations, and we're seeing that how much good it has brought to us. So that was my motivation. I'll hand it off to Melissa.
Yes, so in my role as the Director of Quality Improvement for the primary care practice associated with HMH, we've been trying to get practices to practice evidence-based medicine and routine screenings. then we were approached by our leader, Dr. Ashner, that this was an opportunity, a philanthropic granted funded program, as Ghazalah said, to pilot in the state of New Jersey. And I had known about it from New York, that it was, in other states. And so it was a great opportunity to help our patients. And you'll meet one of my patients, Miss Karma, and her babies, Ace and King, who are on with us today. And she'll share from her perspective how it has impacted her. But for me as a provider, to just have Tierney with me, it's been so great. I mean, we are able to, especially now with the shortage on the formula, we've had people have issues getting, money for diapers, getting enrolled into early intervention for developmental, delays and things like that. She's able to sort of spend more time with the patients after I do the medical part, and, things that they may not want to share. Sometimes people are afraid to tell the doctor if they're going through things that are difficult, like if they're depressed, or if there's intimate partner violence, and they will be very honest with her. And then we can work together as a team to help the families and the guardians, whether it's a mom, dad, or a foster parent, or other relatives. So it's been a wonderful addition to the practice. I think we've impacted families, and we hope that we'll be able to provide the funding to continue the program, and not just at our locations in Hackensack Meridian Health, but in other places across the state of New Jersey.
Thank you both. It's interesting to learn how HealthySteps is integrated into your standard of care. It sounds like you're really taking best advantage of it. Okay, our next question is for Hope and Karma. How did you first hear about HealthySteps, and how is your child or children doing?
Hi, my name is Hope, and I would say I heard about HealthySteps when I went for a doctor's visit with my son, and he's doing really well right now. And I'll let my colleague answer on how she made HealthySteps.
So hi, in all honesty, I actually didn't even know HealthySteps was a thing. I went to the doctor's office one visit, and then I just was introduced to Tierney, and I knew she was a specialist for children. So generally speaking, like after I'm done with the doctor, she kind of comes into the room and she just starts having conversations with me, very normal, like everything's okay, and just checks in to see how are me and King doing. So that's basically, and later on, I ended up finding out that it was part of a program.
That is wonderful to hear, and I am certain very helpful for any moms who are watching. I always feel that learning about the experiences of other moms can be the most helpful for any new mom. And we're looking forward when King decides to turn his head. We'll be excited about that. Camera shy. Okay.
This one is actually Ace. King is the older one. He's 2. He's actually doing early intervention in the living room right now.
Okay, got it. All right. Well, that's why he was insulted. I was calling him King. All right. Okay, Tierney, this question is for you. How often do you interact with a family, and how do you coordinate care with other local service providers in your community?
Sure. Yeah. So typically the goal of the HealthySteps model is to meet with every child and family for each and every well child visit that's scheduled. I know I mentioned earlier that's typically around 12 to 13 visits in the first 3 years of life. But oftentimes, obviously, as we know, the child gets older, those well child visits become less frequent. So what I typically do is I follow up with the families in between the well child visits. I'll do so by telephone encounters, scheduled Zoom calls, virtual encounters. I've even had families schedule in-person behavioral health consults. I also communicate with families by email. So it's a pretty consistent chain of communication. I'm also very fortunate enough in this role to have the opportunity to network and connect with many local community agencies. So I'm able to establish very significant relationships with those agencies directly. For example, I know Karma had mentioned that King is currently enrolled in early intervention services. Very early on in my role in HealthySteps, that was a service that I helped Karma and her family get connected to for King, as well as developmental agencies and things of that nature. So I'll oftentimes make referrals to early intervention, Visiting Nurses Association or the VNA, Fulfill of Monmouth County for food or diaper needs. And with that, I'm able to basically confirm whether or not a family has received those services or connected with those services through my direct agency contacts. I do think it's notable to say it's wonderful because HealthySteps does really bridge the gap for those families that experience challenges navigating certain systems, and sometimes even allows certain processes to become expedited in that sense.
That is excellent. Thank you. Coordinating care and communication is vital to seeing these programs succeed. Okay, so Dr. Malik and Dr. Wallach, how has HealthySteps impacted the families you've cared for?
I could go first, Thomas. I think that some of the things that Tierney just mentioned, we also have a very large Spanish-speaking population. So a lot of times Tierney is doing this with a language line interpreter. And because a lot of times I would give, prior to having Tierney in the office, I would give a mom a phone number, for example, for early intervention. And it's all well-intentioned by me, well-intentioned by mom, but something happens, she doesn't call. Then 3 or 6 months goes by till the next visit. Before you know it, the kid's 3 and now they've aged out of the ability to get the services. So having Tierney here to right in the moment, help mom get on the phone with early intervention. And then all mom needs to do is answer when they call her back to start the process. It's been wonderful in that respect. And, I think the Madonna House, there's other community places. She mentioned Fulfill. We even had corporations, local Wegmans, Target, and CVS give gift cards, and she uses those to buy diapers, wipes, and give them out to families. We've had donations of strollers, books, socks. We know that that's a very largely requested item in shelters of need is socks. We give them out even to kids that are older than 3 when they come with their little ones. So we can give another little giveaway. We have blankets that she's gotten for newborn babies to give out, handmade. So nice. And then lift rides we've been able to get for patients for their well visits because we have folks that don't have cars that come to see us. So it's really been a wonderful thing. And the other thing is a medically complex kiddo that has to see 5 or 6 specialists or 3 specialists. If their mom is having a hard time making those appointments, that's another thing Tierney helps to make. And then she mentioned Zoom calls. She's even helped moms. There's one mom of ours that she's helped with counseling, on Zooms, like a real therapy session in between visits to help her with her postpartum blues. So it's just been amazing. I could not imagine now, not having her there. And we have a great working relationship too. We get along very well. She gets along with my team who is, here behind the door behind me. We all laugh when we're not seeing patients. We really enjoy each other's company, which makes it a really great work environment for everybody. And so I can't say more. I will try to give some time for Dr. Malik. Go ahead.
So each one of our, the patient sites has their own HealthySteps specialist. So I have somebody named Adiza. So she's just doing the same work as Tierney is doing. She's bilingual. That also helps a lot. And she's wonderful having her at my practice. So I've been at Hackensack Meridian Health for 6 years. And for the initial several years, we did not have a HealthySteps specialist. So I can really, me and my whole team, because I train residents and medical students. So the whole lot of us can tell the difference between pre-Adiza and post-Adiza intervention, HealthySteps. We have a lot of families who have a lot of struggles, a lot of barriers to care, complex care issues. We do take a lot of patients, private insurances, as well as under and uninsured patients. So all of them individually, by themselves, any one of those can really, weigh on a family. It is very difficult to coordinate care. You could be able to read, write, and speak English. You could be proficient. You still need health literacy, which is very hard. It is very hard to navigate all the resources available, to navigate through the health insurance system, to navigate through all the subspecialty appointments, coordination. It can get a little difficult, especially if you have multiple children, younger children who need a lot of care or complex care. And that's where Tierney and in my practice, Adiza, have come along, and they have made any recommendation that we make for the family, they've made it actually happen for the family. So the parents might see us every 3 months or every 6 months, but our HealthySteps specialist is able to stay in touch with them over the phone, and they build such a good relationship that they would call Adiza for sometimes things that are not even directly related to the child, but we know that a family's family's circumstances, they affect a child's health. So Adiza has been able to help families so much and has built such good rapport and confidence with them that they do call her for her other issues to where she's able to guide them And she's the one who actually a lot of the time is arranging follow-ups. And if a family is not able to get the subspecialist appointments that we recommended, she's the one who recommends you should come back, see the doctor. So at least, we can bridge that gap. So the families love having her there. They're very open to her. They're not resistant. They don't feel, shy or uncomfortable. And that tells you a lot. Then our trainees, we have a big batch of residents, medical students. They love having her there. They learn from her too, how to advocate for your patients, what resources are out there, how to make them possible for your patients. So like I said, healthcare doesn't end in the clinic, in the office visit, right? It really goes beyond that. So we have definitely seen a huge benefit of having HealthyStep. And like Melissa said, we can't really imagine not having HealthyStep going forward for our younger ones.
Excellent, thank you. It is so important to let people know that these programs exist so that more families can reap the benefits. And I don't know, I can't speak for Tierney, but I suspect that Tierney and Adiza both are loving the fact that they're hearing some great feedback, and it's being amplified to the world right now. So great job, Tierney and Adiza. You are obviously coveted colleagues, so great. I think relatedly, it would be wonderful to have Hope and Karma share with us what type of support you have received from HealthySteps specialists and your pediatrician.
Thank you. So when I went to see the doctor with my son, I didn't know that there would be somebody else who would care so much about our well-being, my son's well-being and my well-being. I was stressed and my son was also not happy. But when we met the HealthySteps specialist, first of all, she gave us teddy bears, she gave my son books, and we're like, oh, I thought every time you go to see a doctor, you just get to go back with prescriptions. But this time around, we had all these gifts, and just not the gifts. The specialist was really nice. She showed us where to get WIC for my son so he can have constant nutritional food, that I don't have to run out of food when I don't have money. WIC already provides food for my son, and also where to get hooked up with community, even to go and get social, some social help. Mentally for myself, I need to meet people. She showed me where to get those. She showed me she gave me the resources to put my son into daycare, and for free. I didn't think I would ever meet someone who would help me like that. So I really, really recommend HealthySteps. Not only that, even early intervention. My son is enrolled and he goes to the school district since May, and that was because of the HealthySteps. And she checks on me all the time. She calls me and she says, how you doing? How is Samuel? How is your son doing? When do you have the next doctor's appointment? Do you need help making their appointment? Do you have transportation? It's like somebody else who really cares about you and bridges the gap between you and my son's pediatrician or your doctor. And not only that, I've been receiving free food from the community as well because of HealthySteps. I'm sure Kama has more stories on HealthySteps. She'll share her part. Thank you.
So yes, hi. So with me, when I went to the pediatrician's office for King, my oldest son, he had his 18-month questionnaire, and we all kind of noticed that he kind of fell a little bit behind. So with that, Dr. Wallach gave me a prescription, told me that I needed to make an appointment for a developmental pediatrician. At the time, I really had no knowledge of anything that was going on. Like, I didn't even know what a developmental pediatrician was. That's kind of where Tierney kind of comes in, and then she really explains everything to me. They gave me paperwork for information that I needed to just call. She also gave me the paperwork for early intervention because that was something that she thought I needed to get an evaluation and possibly would need. So I did all the phone calls with all the information she gave me. I got set with the early intervention. However, with the developmental pediatrician, that was kind of a little bit more difficult to make an appointment. I called them. Literally, it was like July, and they said they weren't taking any appointments. They told me to call them back all the way in December just to see if they will start taking future appointments. kind of like because Tierney always checks in, she actually called me minutes after I had got off the phone with them, and she just wanted to know how everything's going. And I literally told her. She got off the phone with me, she called that doctor's office, and an hour later they called me back. They took all my information and they sent a packet for me to fill out. A week later, I dropped everything off, and the following week, they actually had a cancellation and they called me in right away, and I was able to do an evaluation with King. The first one was on Zoom, and then the next week we went physically into the office. So had it not been for Tierney to actually call them up, I would have never been seen. I would probably still be waiting for an appointment now. I don't even know. Like, it seems to be just really busy and hard. So I was definitely grateful for that. And also, once my child did do the appointment, he actually got diagnosed with autism. So he was able to get that done at a very young age. So anytime when I speak to someone, they're always like, you're really on top of everything. But it wasn't really me that was on top of it. It was Tierney and the doctor's office. So it was a wonderful help. You know, and even with that, like she calls me, she checks in, like it's maybe even if it's once a month or whatever it is, she will call just to see how King is doing, how I'm doing, if everything is going well with intervention, you know, and there's even sometimes because she knows I'm kind of new to the area. And like I said, I don't really know too much about autism either. But one time there was like a party going on, like a sensory party for autism. And she even sent me over an email with an invitation and all the information to go to that. And I would have never known about that. So that was also great. And she also definitely reassures me, telling me that I'm a great mom, how awesome I am, and I'm doing everything the way that I'm supposed to do. And everything is just going great. So I definitely love it. And I love her.
Mm-hmm.
Wow. Well, Tierney, there you go again. I think Pamela, too, also deserves a shout out here. I have to say, you obviously have some incredible people who are working together with you at HealthySteps. Sounds a little bit like a guardian angel on earth. So thank you. And thank you to Hope and Karma for sharing those stories. Tierney, I wonder if you could tell me, May is Mental Health Awareness Month. So I'd like to spend some time talking about maternal mental health. As a specialist, how do you know when a mom needs help and what support do you provide?
Excuse me, I did get a little bit emotional. Everybody's words are really so touching and just really speaks to how impactful the program is. But in reference to Mental Health Awareness Month, so what I feel is one of the most amazing components of HealthySteps in this particular setting is that we establish relationships, as I've said, with families where we're gaining insight into their personal experiences during these sessions. And these sessions can range anywhere from 5-10 minutes to 45 minutes to an hour, even at times. In addition to things like just verbally gauging families, I'm also looking for things like reading body language, parent-child relationships, connectivity. In addition to that, our offices, as I believe Karma had mentioned earlier, we do provide developmental questionnaires. We also provide screenings to allow mothers the opportunity to score their feelings related to postpartum depression and anxiety. So as a result, if there are any red flags that are identified, myself as the HealthySteps specialist then has the opportunity to provide brief counseling services right then and there as a licensed clinician, or I would otherwise refer mothers to an outpatient program for additional supports. So I also want to note, with that being said, that while maternal mental health is absolutely critical when we talk about the parent-child relationship, I do also want to make sure that we highlight parental mental health in general. It is incredibly important, and that does also include our fathers and caregivers as well.
Great. Thank you so much. Karma, I see now we have King.
Yes, this is definitely King. Say
Hi,
hi.
King. Tierney, thank you so much. I wonder if possible, if I could ask you one follow-up question. When mothers are feeling overwhelmed, how do you work with other members of the family to ensure that mom is supported at home?
Yeah, so first, I think it's also important to note that every single mother that feels overwhelmed also feels seen and feels heard. So oftentimes when women become mothers and they experience a transition in their roles, especially for the first time, most people are asking the question, how's the baby? How's the baby doing? How's the baby sleeping? How's the baby eating? And that's wonderful, but not very often are mothers being asked, how are you doing? And so that simple question really goes a long way. For me personally, I would say 9 times out of 10, it evokes such a powerful emotion in the sessions with these parents that a lot of new moms feel comfortable enough and vulnerable enough to even cry in the exam room. I certainly do my best to make these mothers feel validated and remind them that they're doing an incredible job at one of the most difficult jobs on the planet. I can then later walk them through different therapeutic techniques to provide them with the skills that they can then take with them home into their kind of home environment. So for example, if necessary, I can, as Dr. Wallach mentioned, I can conduct brief family counseling sessions, individual and couples counseling sessions, but I can also assign parents or challenge them to mini homework assignments. And that's if they wish to continue to take those skills with them at home and maintain feeling supported. And that looks different for everyone. So that might look like having parents schedule a date night, creating a self-care routine, reading a self-help book, connecting with a support group or therapist, or even just engaging in family activities.
Well, that's a lot. Thank you for sharing all of that. Having a support system at home is obviously so important, especially as a new mom, but every mom needs support. I can vouch for that. Okay, I have one more final question, and this one is for everyone. Can you share a favorite memory from either working with a family or, in the case of Hope and Karma, working with the specialists and the pediatricians? I don't know who wants to start. Tierney, you want to start?
Sure, yeah, I can start. I actually have, I know Dr. Wallach is familiar with this story. One of my favorite memories and a story that I do love to share is the moment that I had recently with a family. I had been working with mom. She was a part of the HealthySteps program with her 2 children. One, I believe, is under the age of 3, and the other's about 4 to 6 months old. Mom was experiencing just quite a number of challenges and hardships. She had housing insecurity, unemployment, financial strain, almost no social supports, and no transportation. But during one of our most recent consultations, mom made it a point to gift me with a thank you card that she had purchased from the store. She had written an incredibly beautiful and heartfelt message inside about how it really just meant the world to her that I had listened to her throughout her struggles and that I just hadn't judged her. I really can't explain how touched I was that with whatever little money that she had, with no transportation, she still made it a point to get to the store, purchase a thank you card for me, fill this out, write this beautiful letter. And again, I think it really just speaks to the impact of the program and what, the impact we make on families. So that's just an example of something that I truly will never forget.
Thank you for sharing that. That's a great story. Karma, given that you seem to have your hands the most full, you should feel free to jump in here now or whenever you want, by the way.
Okay, so I have to think about this. In all honesty, there's no favorite memory that I have. What I will say is I have a favorite feeling. Usually when you go to the doctor's office, it's something you kind of dread, you never want to go to, but you just know you have to go. For me right now, I take going to the doctor's office as if you're going to your grandmother's house. You know, when you go there, you're going to be well taken care of. You're going to get great food. You're going to get great advice you didn't even know you needed. And when you leave, your kids definitely do come home with extra toys, books, Legos, everything like that. So it's definitely a fun experience, and it's something that I look forward going to. So thank you, Dr. Wallach and Tierney, for making the experience so wonderful.
Dr. Wallach, I think that might be your segue.
So, I mean, Karma's already shared. I mean, and the feeling is mutual. I love when you come. It's exciting to see you on the schedule. I want to check in on Ace and King and you and Dad and everybody at home and your mom, who's from Grenada, yeah. My favorite place away from New Jersey. But I mean, since you've already shared some of this really touching stories for me, one nice thing that I heard recently, and I just told Tierney about, was that a dad was so happy with the work that Tierney was doing with his wife, who was having postpartum blues, that he wanted to make sure that I told Tierney how much she helped his wife. So it's just like, it's beyond even just like the mom baby dyad, and that was an example of that. In addition to multiple families gushing at like the thank you for the things that she's helped provide, the warm meals, and the diapers and the wipes and advice, and the fact that like she's told you she really does check in on them periodically. I mean, as you know, we try as doctors to do that, but a lot of times we don't have the time in between patients. So it's so nice that I know for this age group from 0 to 3, I have another set of eyes, another set of ears looking in on my patients for me. And then she's so great at communicating, as you can tell from how beautifully she's communicated to all of you today about telling me and like sharing with me, like, and letting me know if I need to help her from a medical point of view, like, oh, can you do this referral? Can you call this doctor? Like she sent me a message just the other day. Oh, the doctor's not available till, a bunch of months away. Can you call in as doctor to doctor? And of course, yeah, I'll do that, and if I wouldn't know if I didn't have this extra person. So I'm very grateful for the program. And I think it was a great idea that was started by Ms. Briggs. What a great concept. The integration, I think we shouldn't be in silos in medicine. I think medicine is a truly integrative thing. I think we need to address the social determinants of health all the time. So it goes, like you said, so much beyond the office. And so I'm grateful to be a champion for this program, and I hope to be able to spread it across the state. So any funding we can get to do it would be great. So
great. Okay, we'll Hope, Dr. Malik. I'm not sure who wants to go next, but you're both up.
Dr. Malik, you want to go? All right, I'll go. So I would say my most favorable experience was when I went there with my son, and that time he was crying. And here comes the Healthy Steps specialist with teddy bears and books and toys. And when my son looked at her, instantly he kept quiet. And I was like, oh, there's somebody else who cares about my son more than I do. I mean, I do care about him, but in that moment, I didn't know what to do, how to help him stop crying. And she just showed up like an angel. And for me, that experience was amazing. I kept telling myself, oh, where do they get those toys from? How do they get those books? How can I contribute? How can I, donate so that another family also experiences this bliss? Because being a single mom can be tough. And if there is anybody else who can show up in that moment when you really need support, I would really say everybody else should help Healthy Steps keep going. And let's talk about Healthy Steps. Tell moms around about Healthy Steps and people. Thank you.
Thank you very much. Sorry, I was mute earlier. I didn't realize. So, I mean, there's so many stories that not just myself, but our trainees actually share and appreciate from Adisa. But there are many stories where we've helped families, and there are a lot of so not only Healthy Steps, Adisa has started so many other programs, for 0 to 3, like book donations, and she reaches out for this program Veggies RX, where we started this program. It's a funded program as well, where Adisa arranges for sort of prescription pads, where we write the prescriptions for certain families who we think are in need, and they can get free produce through this grant. So having Adisa and having our Healthy Steps specialist has opened the doors for so many other resources for our families. But there's one that I really love, that I wish that we could expand this program or have another program that's beyond 3 years of age. So we've had families who were in like dire need of help because of their complex situation. And the child, for example, was over 3 years old. And we were like, I wish I could involve Adisa. It's a grant funded program. Adisa is wonderful. She would help anywhere we need help from her. But the program is for 0 to 3. The funding is 0 to 3. So we had a sibling. The child had a sibling who was under 3. So we were like, you know what? The child's 8 years old, but there's a sibling who's under 3, and the whole family is struggling with this situation. So like we find creative ways of pulling Adisa into a family's life to help stabilize their situation, to help support them, to coordinate care, to improve communication. So this is the impact that having Adisa with us has had, that even the kids who sort of fall out of 0 to 3, we try to find creative ways. And Tierney and Adisa, they have a wonderful attitude. So that helps even further. I mean, just goes to show that they chose this field, they chose this specialty very thoughtfully because they have the personality and the attitude that is helpful. They go above and beyond. So that really touches me, the fact that I myself and my whole trainees, like we have 50 trainees in our program, we all try to find ways of involving Adiza in every patient, and she's just more than ready to help. So it's a wonderful, teamwork.
Fantastic. Well, thank you all so much for sharing. It's pretty clear that the work of Healthy Steps is not only helpful for the moms and families, but also incredibly meaningful for the doctors and the professionals who are participating in the program. So hats off to all of you. Our time is coming to a close, and it does not appear that we have gotten any questions online. So I guess I will start to close out our time today. I'm always thrilled to learn more about all the programs across the state that are working to support our moms and families, and I'm so grateful to count them as partners to Nurture NJ. I would really genuinely urge anyone who is watching to share this link to this episode on their social media for other mothers and families to learn more about Healthy Steps. You never know who you may be helping. I want to thank our incredible panelists for taking the time to be here. Their thoughtful responses, enthusiasm, and of course their dedication to New Jersey's mothers and babies is fantastic. So thank you all. Have a great and safe end of your week and Memorial Day weekend.
Thank you.